Hello, everyone, and welcome to Let's Talk Climate. I'm Jennifer Giordano, and today we're bringing you a research episode. We'll be taking a closer look at ecoAmerica and the American Psychological Association's 2021 edition of the Mental Health and Our Changing Climate report. If you joined us for the launch webinar, you may already be familiar with it. This short research brief is part of a series that will dive deeper into the report's sections to provide more insight. I'm joined by ecoAmerica's Research and Marketing Manager, Nicole Hill, who co-authored the report along with ecoAmerica Executive Director Megan Spicer, Director of Sustainability and Assistant Professor of Environmental Studies at Macalester College, Dr. Christy Manning, and Whitmore Williams Professor of Psychology at the College of Worcester, Dr. Susan Clayton. Let's give a brief overview of the report before we dive into today's focus. Nicole, how would you sum up the Mental Health and Our Changing Climate report for our listeners?
Hi, everybody. Thanks, Jennifer, and thanks to everybody who's joining us today. So the 2021 edition of Mental Health and Our Changing Climate is an update to the very celebrated 2017 version of this report. It thoroughly highlights the impacts of climate change on Americans' mental health and psychological well-being. What this updated version expands on are disproportionate impacts and populations disproportionately impacted. It expands on climate anxiety, which some listeners may have been hearing in the news lately. And finally, it also expands on solutions. So that's the quick summary. The full report is over 85 pages with references. So this series is really about breaking it down. Everything in the slides today can be referenced also in the back of the report. So today we'll focus on putting the report in context and how mental, physical, and community health are impacted by climate change and also linked to inequities. And then we'll wrap up by sharing the psychological barriers to action and climate solutions that benefit mental health and overcoming those barriers.
Thank you, Nicole. I'll share with listeners before you get started that I encourage you to check out the launch webinar in the description. It features the authors and special guests. Okay, Nicole, please put climate change and mental health in context for us.
Great. So on my screen here, you'll see this graphic that shows the overlap between mental, physical, and community health. And then the center highlights that all of these are linked to inequities and vulnerabilities. Often when we hear about health impacts of climate change, it's about those physical impacts, and those can be seen in the upper left circle. These include injuries and fatalities, heat strokes, allergies, and many more. And as a quick example of an injury or fatality from climate change, severe storms are becoming more common as a result of climate change. And with flooding, one might be struck with debris, become injured as a result of that, or might be at risk of drowning. According to the National Weather Service, 127 people die on average in floods every year. So there's no doubt our physical health and climate change are very closely linked. What's important, though, to remember is that these are all connected, all three of them. So an example of that connection is, let's say one's home gets destroyed from a severe storm, or maybe their local pharmacy, and then they can't have the same access to their medications. So it's all linked, and understanding the connectedness helps us look at solving climate change holistically and create policies that consider mental health. The center of this graphic displays that people are not affected equally by climate change. Although stress is a normal part of everyday life, for populations made vulnerable by social and economic circumstances, the stress of climate change takes a much deeper toll. There's many social factors that play a role in the risk of experiencing mental health tolls, such as educational and occupational opportunity, poverty, access to safe housing, adequate nutrition, and affordable medical care. So climate change exacerbates the negative effects of social determinants like these, which can also deepen the burden on people from marginalized groups. And in the report, we reference this as stress proliferation. So as we go through this series, breaking down the findings, you can always refer to this graphic. It's on page 17, and it's a great primer to those links.
Thanks, Nicole. This report shows the disproportionate impacts of climate change. Would you give us an overview of where climate perspectives are today before you get into the psychological barriers that keep us from taking action?
Absolutely. So first and foremost, concerns about climate change are growing in the United States. In April 2021, 78% of adults in the United States reported they were either very or somewhat concerned about climate change. Furthermore, Yale and George Mason universities, they identified an alarmed group of Americans in their Climate Change in the American Mind research. And that group has actually nearly doubled between 2017 and 2021. And now it makes up nearly a quarter of the US population.
If so many are concerned about climate change, why hasn't that translated into action necessary to dramatically decrease emissions?
Well, there's a few factors that may move people away from action, and these include psychological distance, belief systems and climate skepticism, pluralistic ignorance, fractured hope, and the need for efficacy. So first off, psychological difference refers to the idea that climate change is a distant worry. It's something that's going to happen to others at a future date, but not perceived as something that will harm you right now. And even though concern is fairly high, only 45% of Americans say that they are personally at risk of harm from climate change. So this sense that climate change is a distance problem really creates a barrier to personal and public engagement with the climate crisis. Then belief systems and climate skepticism also play a huge role in how we think about climate change too. There's a term called motivated cognition that refers to the phenomenon in which we selectively interpret the information we hear rather than looking at it in an unbiased way. So through motivated cognition, we often try to keep a world that aligns with our belief system. And one example is many of the proposed solutions to mitigate climate change, such as large-scale government programs, regulation on industry and businesses, a tax on carbon, those directly conflict with the conservative political worldview that prioritizes a free, unregulated market and limited government power. And so this partially explains, too, how climate skepticism has grown and become a real barrier to action. Some studies show that conservative identifying people in the United States tend to downplay the climate crisis, misremembering winter temperatures as colder than they actually were, or doubt that wildfire or other disasters were worsened by climate change. However, I'll note that climate skeptics really make up a small fraction of the American population. So then pluralistic ignorance is the idea in which people's ideas about what a group thinks can differ from what the group members actually think, and that can inhibit the acknowledgement of a problem. A real world example is that in 2019, 74% of Americans said that they were concerned about climate change, but only 59% said that they believed others around them were concerned. So this gap in actual versus perceived climate concern could be contributing to silence on the issue because people feel alone in their concern and are afraid to step out of their group's norms. Then fractured hope. Those who lack hope that climate change can actually be fixed and believe that there's a way to fix the climate crisis are actually less likely to take action. And it's an important ingredient in proactive response to believe that solutions work and that climate change can be addressed. So fractured hope can get in the way of action too. And then finally, the need for efficacy. Studies should suggest that we need to both believe in ourselves, that we have the ability to take necessary actions, that's self-efficacy, and that those actions will result in helping solve climate change, that's outcome efficacy.
Thanks, Nicole, for explaining those key barriers that may inhibit us from taking action. The report isn't just about impacts, it is also about solutions to support climate and mental health. What does inspire action?
I definitely want to cover this part of the report because it's not all about barriers. There are findings that may prove useful to inspire and empower climate action. So the good news is that these barriers can be overcome with visible leadership and action on climate by people Americans know and trust in their daily lives. One study found that people were far more likely to get involved in public sphere actions, such as donating money or contacting policymakers, if they believe that their social group was participating. Visible leadership and action from healthcare professionals in particular may also prove to be helpful. Earlier this year, 68% of adults in the US said that they trust health professionals as a source of climate change information. And then personal experience with impacts, or better yet, personal experience with solutions, can also prove to be helpful. People are feeling the effects of climate change already today, and often after experiencing an extreme event, it will stay salient in their mind. People in the UK who had experienced severe flooding not only felt more at risk from climate change afterwards, but they also expressed greater support for policies that address climate change. And then finally, helping people make the connection between climate and their family's health, both on the impacts of climate change and, again, better yet, on the solutions and benefits, can also change behavior. So providing information about the personal health benefits of a specific climate mitigating behavior can lead to greater expressed willingness to adopt those behaviors, such as replacing driving with other forms of transportation or eating more vegetarian meals. And talking about these connections doesn't necessarily need to be centered on climate change, so discussions can focus on the specific impacts like hurricanes or heat waves without using the phrase climate change.
It is encouraging to know that there are steps we can all take. Is there anything else you wanted to share with listeners today?
Yes, I want to end on how we can shift the narrative towards solutions and benefits and outline how climate solutions can support mental health and community well-being. So the good news here is that steps that are taken to mitigate climate change or adapt to its impacts will also have clear benefits to health, including mental health. For example, a switch to clean energy, such as wind or solar power, reduces air pollution that comes from fossil fuels and contributes to climate change. And air pollution not only harms physical health, such as through reduced lung function, but it also has a harmful impact on our mood, social behavior, and cognitive functioning. So cleaner air should enhance mental health as well as physical health. And there's also lots of ways that you can personally act on climate that may also directly benefit your mental health. People can reduce their use of fossil fuels by driving less and walking more. Walking as an exercise has benefits to mental health. And if people are walking around in inhabited areas, they may engage in more social interactions, which has benefits to mental health. Meanwhile, driving can increase risk for depression, anxiety, PTSD, and other mental illnesses, according to the California Department of Public Health. So solutions to climate change are solutions to its mental health impacts. And in a later episode, we'll go even deeper into those impacts, deeper into the solutions, and we'll share resources for resilience too.
Excellent. Thank you, Nicole. It's clear there are major co-benefits to addressing climate change, including benefits to our mental health. We'll dive even deeper into the report in the next episode in the new year. But for now, I encourage everyone watching to take a look at the full report on ecoAmerica's website, and it's linked below in the video description. Please join us in sharing these findings with your network. Let us know if you have feedback on this episode or ideas about future topics. We're at research@ecoamerica.org, and join us every Thursday for live episodes of Let's Talk Climate. You can subscribe and follow @ecoAmerica on social for the latest research and resources on climate action and advocacy. And our next episode is on January 13th. We'll include a registration link in the description. See you then.